Good evening, everyone. Today's topic is about how to increase our citation. So, I'm also available in my YouTube channel Pain Free Partha, and most of my slides are available in www.painfreepartha.com. Now, anytime I talk anything on academics about, salute to the legendary teacher of 2 centuries, Professor Ravi Shankar, and to increase our citations. This is our topic today. So, why we need this? It gives credit to us. It adds strength and authority to our work. It places your work in a specific context and leave it check. Now it gives credit means what? Now we have done a study. Okay. Now that is cited 10 times. That has been read by so many people. That has been referenced by so many people. That gives the credit to us. It adds strength and authority to our work. For example, one of my randomized control study is cited 100 times. Now you see, it's an authority of an RCT on the subject. It places your work in a specific context. Which place you are in that? Leave a trail for other scholars. For example, now Rajini is moving. He gives a trail, means the footmarks. And this is the Ram's jungle trail. How he walked in the jungle for 12 years or something like that. So this trail for others. Now we have done the RCT. We have done this thing. Now somebody else thinks about it. He wants to separate this. Okay, that is about the need for increasing citations. Now, what is my academic achievement? Sometimes may call it. Now it is 664 citations. This is after 2018, 488 or something. So there's around 670 citations I'm achieving. Somebody will say 1,800 citations. Somebody will say 3,500 citations. So it's an achievement in academic purpose. Now, because an excellent outcome of protocol-based treatment of motivated type. See here, a real-world follow-up of 11 years. I've quoted our article, Diabetic Profile Screening of HbA1c, a community assessment. This article tells that the community assessment that our Indian HbA1c random is around 8.91. So, in a study of 25 countries, Indian data is put like this. Our article, Indians are likely under uncontrolled. You see the reference, it's our article. So, it is an academic achievement. Now, what are the steps to increase the citation? How to do the citation increase? In the title, you have to put as randomized controlled study. See here, our article, randomized controlled study. If it is there, it is likely to be picked up by the other authors. We can also see here, if we give a preemptive nerve block on opioid consumption in patients undergoing nasal surgery under GA, a double-blind randomized controlled study. So, we can also use preemptive block decreased opioid consumption, like that. Effectiveness, we can also put like this. For example, a structured nursing care. A structured nursing care improves pulmonary outcomes in patients undergoing gastrectomy. So, for example, this is the effectiveness of a structured nursing care. That is the one side. Now, we can also say a structured nursing care improves pulmonary outcomes. Or we can say effectiveness of a structured, both are okay. But prefer to have no questions. Does a structured nursing care improve pulmonary outcomes in major abdominal surgery? No. Prefer no questions. Does a preemptive nerve block decrease opioid consumption? Does a one-to-one nursing care better outcome in toxicology critical care patients? No. A one-to-one nursing care betters outcomes in toxicology critical care patients. Or effectiveness of one-to-one nursing care in understanding the outcomes of toxicology. It should be like this. No questions. So it is preferable to have multi-centric studies and systematic reviews and meta-analysis. These get cited better. Collaborate with other researchers, co-author papers with them. For example, there may be nursing friends or they're in the Gulf. So you understand their problems, they understand your problems, set up a multi-centric study and give them. So it will go into many countries. Your research will go into many countries. So get some friends from the Gulf or get some friends. Even if you're not finding friends from the other countries, you can get friends from Kerala, Bombay and all. So go for a study which goes into more number of areas. Now this is about title and this thing. Now you got to keywords. Now keywords also is to be picked up by the Google search. So you have to have exact Google words. Now keywords. Now if I have put a search of diabetic neuropathy and this popliteal static block, yes, this may come or this may not come because it may pick up either the title or this thing. Okay. Now, for example, a nurse education protocol decreases infection after intravenous cannulation. If you follow a structured protocol, then it decreases infection after small intravenous cannulation. Okay, this is our topic. Now you have to put slightly different, get the internet search and pick up. So infection, cannulation, IV cannulation, venous cannulation, something like that in the keywords so that it picks up. So it is not necessary the same words should come in the keywords. You can alter it. So sometimes we may need to write in abstract so many times, and abstract should not be zigzag like this, and it should be very clear. For example, some of the journals will not open at all. They are not open access. If you click the abstract, only will come. Okay. These journals, if they are picked up, your article is picked up by some other researcher for there to cite, then your abstract should be very clear. If your abstract is not very clear, for example, abstract should have aims, abstract should have clear methodology, very clear. How did you do your structured nursing program? How did you randomize? How did you blind? What is the statistics used? All these things should be brought in 300 words because the fellow need not go to the original article. Original article may be full paying article of 350 pounds or 336 pounds. So he will not purchase the article. So if you have a good structured article which clearly tells what you want to tell, then he will cite you. He need not have full articles. Same name. Here you see this is my article which has got Parthasarathy. This is my article which is got Parthasarathy and this is and P. All these things decreases your chance of citations. So you have to have the same name. Parthasarathy, yes. Sivashanmugam D or something like that. Kotur PF. Something like that. Same name should be get. If something comes as Prafalla Kumar K, then K Kotur will not be there. Prefer open access. If there is open access is there, citation will be there. Make your manuscript easily accessible. Now this is an international journal of medical anesthesiology. It is not one big journal. Now we have put this article, but also what I have done is I have uploaded in my website. So more access is there. Sometimes if you search myomectomy, severe aortic stenosis, the website is being picked up, not the journal. The website will show and they will download from the website. RCID IDs, it's very easy to have RCID IDs. Intermittent fasting, this is our article. Now this is an ID, RCID ID. If you click there, your RCID ID will go and out of articles. So you should have sometimes because now you see this is yes Parthasarathy. But here my RCID ID is there. That is why Mahatma Gandhi Medical College, Sri Balaji Vidyapeeth, Pondicherry, India. So this ID should be there in many of the journals articles, or at least you upload. They need not put it in that or put it in that. Share your data in Figshare, Mendeley, all these things. For example, open a Figshare account, open a Mendeley account, and upload your articles. Open access, free access, no copyright. Put them everywhere. Put everywhere in these things. Share your data everywhere so that sometimes if your article is not picked up from the journal, it will be picked up from Zenoda. So that is why share your data everywhere. So DOI is given by cross-reference, digital object identifier. This is a number, IJAKSM/12345/5376 is a number will be there. If you click that link, your article will be showing. So that is DOI. There are other DOI gives. Zenoda gives free. DOIE gives free. If your article published in a journal, for example, Journal of Reattached Therapy, this journal will not assign a DOI, but it will be shown as URL. If you click the URL, the article will come. But this URL can be converted into a DOI from Zenoda. So, or DOIE. So, get a DOI and you cite your, when you are citing yourself, add the DOI. You can also pay an increase. For example, this is an Enago is a citation booster. If you pay $400, how much it is? It's 30,000, 25,000. My citation may come from 664 to 1,000 in 3 to 4 months. So it's a citation booster. This is marketing. We may not need this. Now, one article of ours, the impact of meditation for ensuring better stroke patients in a systematic review. Now I have created the DOI. This is the DOI. If you click this, it will come. This is the QR code. If you scan it, it will come. So we have created the DOI from the DOI engine. So we can add this DOI. This creation of DOI increases the chances of getting cited. Publish a review paper to increase the citation score. For example, I have worked a lot in populator static blocks. I have worked a lot in music therapy, 4-5 randomized controlled trials. I have worked a lot in labor pain and nursing care. So start writing a review article and cite some of your articles. So this is one way of increasing the citation. This is self-citation. I will come back again to that. Talk to researchers and friends. Go to conference. Present your things. Talk to friends. We have done a good article. We have done a good article on labor pain and nursing care. We have done a good article on use of Entanox in labor pain. We have got a good article in communicating with the husband when the patient is having labor pain. All these things we talk to researchers when you are going. So go to Facebook and paste the link of your DOI. This is this article's DOI I have pasted. Now, what is the problem is most of the Facebook friends are not doctors, are not nurses, are not medical people. That is why I have written my article in Indian Journal of Anesthesia on nasal surgery anesthesia. Now, I have not written here preemptive net block at all. I have put the link. If somebody interested in nasal surgery, they will click and see, and it may reach another 10-15 people. That is the advantage of putting the link in the Facebook. Now you see, this is our article, single point, published in September issue, hardly around few days back. So in September issue of 2023. Now I have put in anesthesia PG news, anesthesia news, anesthesia PG Kerala, Karnataka, all these groups. Now somebody clicks that, and it may be their thesis also. So they may get the reference like this. So nobody knows. There are some 500 PGs in this group. There are some around 240 professors in this group. Some 20 people see this. Yes, out of which 3-4 people are working on this static nut block. Yes, it may reach those people. ResearchGate, open a ResearchGate account and add articles if open access is not there. If an article journal is not giving open access, you can upload the document as a original Word document, not as a published PDF. So Google Scholar 663. Yes, we have to have one account on Google Scholar. We have to have an account of academia.edu to improve our citations. So because papers uploaded 69% more citations. Now, one of the articles of mine is, if you check it, click it in the Google, that will not show from the journal, that will show from academia.edu or Semantic Scholar, all these things. So upload everywhere is possible. LinkedIn, Twitter accounts, all are free. You don't need to pay for anything. Start writing book chapters. Now you see, role of fruits in Parkinson's disease. My wife and me have done this, and we have cited a few articles written by us on rare fruits. So that is one advantage of writing book chapters. So not only Parthasarathy has to do these things, ResearchGate, Twitter, and Facebook, WhatsApp, all these things. All our co-authors should do this. So it will reach, if you have 5 co-authors, 1 plus 5, 6, 6 into 36. For example, Twitter, Facebook, ResearchGate, all these things. 6 into 6 times, 36 times it will go and reach many people. It is likely to reach many people. Citation manipulation is a problem where references do not contribute. For example, this is a problem, self-citation. This problem has come up now because of some other problems. So, scholarly content of the article. For example, now the article is about a very simple thing. Okay. What is the difference between a psychiatric nurse and a physiotherapy nurse with relation to anxiety reduction among patients attendants? For example, this is the article we are working with. Okay, or otherwise we are working on some other thing. For example, one plant is there. We are doing an alcoholic extract of the plant and asking for GCMS studies, MTT studies to find out antioxidants, carbohydrates, proteins in that plant. Now what we do is, we have done 6 studies like this, GCMS assays in different plants. Okay. Now in this plant in Blamicha, where we are doing this route. Now you go to quote all these things 1, 2, 3, 4, 5, 6, which we have done GCMS assay in many plants before, but it is not related to this thing. We have not quoted as reference the original author was found out the GCMS assay. What we have done is GCMS assay we have done in many things, and we have quoted like that. So this is some sort of citation manipulation. We enter something in the text which is not very clearly closely in content with the text and add citations for that sentence. That is what is the problem. Now this is a fellow who has got an award for his citation, 7,000 citations, out of which 95 to 99% of his only. But he tells, I have worked, only I have worked in this. And there are 150 articles, he has cited all the 149. 149 articles, he has cited all the 148. So it is preferable to do self-citations. 10% less for the author and 10% less for the journal. For example, now you have an article which has got 20 references in bibliography. 20 references, 2 is okay, your own self-citation. 2 is okay for the journal. Now you are working on a journal called something like multidisciplinary reviews. This multidisciplinary reviews, not more than 2 articles for 20. So less than 10% for the journal. There is one journal called Biomedicine which allows nil. Unless we prove 600, then only gets into the reviewer. What is citation stacking? Refers to anomalous citation activity of a disproportionate number of exchange. Now, one publisher puts 2 journals. One publisher puts 2 journals. Number 1 journal is Multidisciplinary Journal of Nursing. Number 2 is Indian Journal of Psychiatric Nursing. Now, what it does is, if Indian Journal of Psychiatric Nursing, he cites all from multidisciplinary, and in the multidisciplinary, he cites all from Indian Journal of Psychiatric Nursing. This is what is called citation stacking. Sometimes Suchitra is working in Shastra and her friend is working in Avnashalingam, and she writes an article and cites some 10 articles from Avnashalingam, her friend, and her friend writes one article and cites all from Suchitra. Then it becomes citation stacking. Style does not matter. It may be Vancouver or AME style, the website or the internet picks. Now here the number of citations are usually like this. It picks up 1 or 2 years and then slows down like this. But this is one journal. There are few journals where the citation is very high. If you go to the net and search for some anesthesia article, if it is published in AR, it will pick up first. I don't know what search engine optimization they have done this journal. So some 4 articles they have published in the journal. So 4 into 2500, 100 citations are from this. Now, what is H index and item index? Number of citations is, what is that? Number of citations do you mean by that? Now you are writing an article and references. In the reference, if your article is there, then it's a citation. So much is 664 citations for us, and H index is 14, means 14 publications of me are cited 14 times. If your H index is 5, then 5 publications of this person is cited 5 times. Item means it is 20 articles are cited 10 times each. Number 1 article is cited 10 times each. Number 2 articles 10 times each. 14 articles are cited 14 times each. My formula is 20 years of researcher, H index can be 20. That's very good. Now we go into the other person, our chief. Now he has got a citation of 1780, but H index is slightly on the lower side. That means 23 articles are cited 23 times. It's slightly less when compared to this. The citations are not widespread. That means a few articles are cited excessively. For example, his first article, VAP, ventilator associated pneumonia, is cited 192 times. So that is what is the difference. The citation is not spread much. He has got a lot of some 10 good articles that are cited 100 times. Then a few are cited only 20 times. That is why it is less. Write a good article and choose a standard journal and publish. These are the 2 best techniques to have good citations. Write about emerging concepts. Start writing about COVID-19, which is gone. How will you get citations? So to summarize, a good article in a good journal. ResearchGate, Scopus, or CITATION. Open all these things and start. All the co-authors should do that. Start writing a book chapter, start writing a review article and cite. Better less than 10%. Giving DOI, make open access articles. So these are the fundamentals to increase your citations. Fundamentally, you should know the citation is not going to increase within a span of 2 months. It's a span of 2 to 3 years or maybe 10 years. So we work now, you will get the result in 2028 or something. That is what I want to tell. Thank you all. Thank you very much. Go to my channel, YouTube, Pain Free Partha, and enjoy.